by then Medicine Demo, and they were in country as an NGO. And then the government that we were started running it after Medicine Demo shut down and left the country. But ever since they have been doing very well in the country. But over the past they were lacking behind some of those basic materials that would be needed for the hospital. But as we are where we are now, the hospital is now the best or one of the best in the country, if you don't mind. So the hospital, prior to us coming here on this regime, there are a lot that we met that we have corrected and it has been ongoing as it is. For example, those days, if you come here with a patient to enter from the hospital gate and come up here, if you're not careful, out of the motorbike you're on, and the patient will fall on the ground.
Okay.
Okay, because here was very muddy, the erosion hit all the place. And we took over 2 years ago under the leadership of Minister Dr. Louis N. Otto, and we have been able to do a lot of work here. As you have seen, the hospital front is now paved. We have this smoothly going to the ER. The hospital yard as a whole, we hope people who come out with their patients for treatment, because the smell of the place smell, give you that good smell that when you are here, you are like you are come to get life. Recently, we received an ambulance from Governor Nadura. It's still brand new. It's the last week. Okay. Also, from our government allotment, also, we procure 2 vehicles pickup truck. Okay. One is there, one is right now in service. Parking right there, one is right now in service from our allotment. And the bus there was purchased a year ago for the hospital staff. And bus. Very useful. Looking for their medication. The hospital yard, that nice view that you are in a health center, that you have come to get life. Okay. ER is something that is so basic every day because it was built by then in Maternity Hospital. But over the years, we have been upgraded to a full-fledged hospital. Meaning now we have piece of children and men or males that come here for services. So we have female, we got children, we got adults, and all things that we have here. The hospitals that have become so small for the people of one county, meaning Banasidi. So we keep people from Mike as well, sometimes Lofa, Grandpa, and Nimba. Sometimes go as far as Guinea, patient for cases. So our load here is so huge, and the hospital building itself is small to take care of all those people. Even right now, as we speak, we are constructing an annex at the hospital back there that you'll see later when we're supposed to go along. Okay. That will be finished this year, very anytime and this year. Is one of the busiest places in the hospital on a daily basis. As the day, the room we hire, the best we have here, it's very small. And then the ER, all the patients that come here on a daily basis. So the ER is so busy for patients that come in and out on a daily basis. And to have them and make testimony, sometimes with no space, they are constrained and sometimes somebody complains that what is very no space.
They ask me what they can do. They ask me what they can do for you, so I'm going to do it. Yeah,
very key in the hospital with privacy. So those people with privacy, that's the need. They are enough here. Here is wash. Have it dry right here. And what we take to a partner gave us those machines some years back. Two machines given us by a partner. And so they are very, very useful to us in the hospital.
And they are also functional right now?
They are all functional. We say functional, they are still functional.
Okay.
Yeah.
So there's a new...
The annex is right now under construction.
How many beds, Annex here?
The annex was constructed or is constructed in the size of the IPD. That means we have fewer walls. It should be around 100 or 75 beds when we complete that. We will determine as to how many beds to put there. But the spaces are so unique, the spaces are good. But it is meant to boost the force on the main hospital. So they got two steps there. They got the first step here. That will be for the baby for the leaky.
So when was the project started?
The project started in 2019 on the past meeting. And so I took work as an administrator right now. I want to get on her. For the plan to do the project. The hospital is very small. So more crowd out on the public. So when it's finished, I will push the healthcare provider.
Alright. So let's do it.
Back or the hospital, so we can have this space very clear for
Alright, so
yes, so here we have what we call the caretaker waiting center. That if you bring your patient to the hospital, and then while they are in the facility giving them treatment or care, you are in here to maybe to cook food for them or to take care of their hospital material, hospital clothes, here where they sit. They were built by some people in Concande. The particular structure. While we have money to have it completed this year, but because of this, others have been constructed there, we want to relocate the building at the back of the hospital. So I have to talk to Puri as a day. So after the hospital is on the there, we can have it for another purpose, for another use. But for now, they are using it for to relax and put up there and that's a close. See, put it around, put that close after this. So there, we have the ART clinic there. The ART clinic. And of course here is our powerhouse. Recently we have a generator that was sent by the Minister of Health. Machine that is brand new, 150 kV generator that was brought through the PSRP project in the We have installed machine is right now in use as stand. It helps us as a standby generator when current go, and we power the hospital so that we can handle in the hospital at all times. That model was used 2014, 2024, 2025. It was used for the entire country of one. But we didn't have one model for the entire country. So we use the OR Plus, so the engine is now small. So you see it's quite young. And then we have new brand one of this thing. And we are so happy with having one umbrella for us. But there are some at the country hefty. But it also been used as a backup when there are other calls that have been made from other places around.
Okay. 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 So I think we have, alright, so I think we have gone, we just So, just tell us, how many patients do you receive?
As you can see, most of the time, today I have received 9 cases. And you can see here. Today, the 9. I received 9 cases this morning. And every one of them received their treatment.
Okay.
And one of the great things I'm so grateful to the administration at this place. Most of the time when we procure our medication, it's available.
Okay.
On time. When the patient comes from distance and they receive their treatment, they can feel fine. They can feel too happy. Because some of them paying their way to come, and most of the time we give our treatment here. So now 1 or 2 months because of the rainy season. Yeah, and the bar road. And also transportation. So at least they can be able. We can only now do our follow up on phone call.
Okay.
Yeah, to see how they are improving. So most of the times you can see we have their phone numbers all here so that we can call them just in case any problem. We call them and see that whether they have some side effects of the medication.
Okay, what's your name again?
My name is Joseph Simon.
Alright.
Thank you.
Naomi, and Naomi is one of she's the only here specialist to have in the facility. She work on people here, making sure that here very well. She also a medical professional. So when we here have no patients, she go to other areas in screen. Now I see she in screening go as well because no patient for here today. Naomi is here.
My name is Naomi L. Smith. I'm a registered nurse, also a ear specialist. So yeah, I see you come out of the ear clinic. That is removing compacted wax to remove for the ear, for the ear, removing foreign bodies, also treating ear infection, and helping to restore hearing for those that have a loss. Not very much because it is a new thing. We started since last year, but it's not easy because number one, I always told people, ear is not an emergency. So sometimes people will come like for a month and we get 10 to 15 patients. But in doing so, I also go from school to school to carry on outreach activities. But sometimes based on the condition, I take the number and to follow up. Yeah, so you come back for the follow up.
We are here talking to some of the people here, and the people are. So the women are here, let me talk to you.
One of our patients. Yeah, I do talk to you.
Hello? Okay. So what are you here for today?
Yeah, I'm not doing well.
Yeah. Alright. So you getting treatment from here? Okay. So what are you doing right now at this place? There we go. So they did all your tests? Okay. We are here, and what would you like to say to the people about when it comes to the healthcare in Bonn here? The people working, or what do you want to say?
Well, we can tell the people that are here, thank you. We should be proud to praise them.
Okay.
I welcome you here. When you come, they give you the card, which is the hospital card. When you go say, you come by, you're not just wasting here now, when you go take it. Not the one they give you to all free.
Okay.
So you save it for your life.
Alright.
I was sick. Now my body, they each like on me. That they call me. Yeah? Now my body.
So you're paying for the medicine?
I only pay for my lab. For the medicine, they give it to me free. The foreign medicine I go here free.
Okay.
Yeah.
Okay. So the people, they're trying their best.
Yes, they're trying their best.
Alright.
They're not there before.
What's your name again?
My name is Teresa Katamla from Smuka Wolapo.
Thank you so much, ma'am.
My name is Rebecca Smith Moy.
Okay. Okay, so you said Moy? Are you related to the senator?
Yeah, I'm his assistant.
Okay.
So this office is here to coordinate activities of the nurses and midwifery services in the hospital, make sure that all of our patients receive quality health services at all times, make sure nurses and midwifery are on shift, and provide services for the library.
By the grace of God, you know, leadership is a skill that if you have, all can be in it. By the grace of God, from the time we took over, I think it was an hospital, it's an increase in our patient load. And other things, somebody will tell you, and I saw people leaving, I mean, any problem we have on our very well, we discuss it. Where we got challenges, we work together to solve those problems so that we can have a smooth operation. So far, we don't have any issue that will hindrance our services to our patients. Human and people come from diverse background. We cannot sit here and say at all it don't happen. But when it happens, it comes to our attention, we take administrative action. If they require warning letter, you register. And those are things that we inherited as nursing services when we took over. Patient complaining, oh, the people don't come to work one time, they don't talk to us good. We saw it as a challenge. So what we did is that we have a full general supervision of the hospital. That is 24 hours around the clock. This office must have somebody supervising the shifts, making sure that patients that enter the building, the services they keep for, they should get it, and on time. And if there are any problem anywhere in the night that will hinder patient care or staff not coming to work, is reported before the day, and then we take the necessary action to correct that. So far so good. People come to work on time, our patients receive their care on time, and CB Doma, we're just doing very well. The highest or the second to JFK Maternity Center in the Republic of Liberia, maybe next to Redemption, I can say, because we go up to having 200 deliveries per month. So, I mean, for maternity cases, our case load is very, very high. Because we receive patients from Lofa, Nema, Bapolu, and from Guinea as well. So, because of our location, our patient load is very, very high right now.
Okay.
Thanks up to my team at CB Doma, the nurses, midwifery, even our doctors. They're working tirelessly that Liberian get health services, and it is part of our arrest agenda. And I want to encourage them to keep working, because the news is out there about CB Doma. So when you come on ground, the work should be actuality. So I want to also tell the government thank you, because some of those lab and things we're not doing, CBC, creatinine, and I mean just name it, cholesterol, we're doing all of those tests at CB Doma for a very minimum amount. And happily our OB receive ultrasound free of charge. They don't pay anything. That's why the drug revolving. We want to treat OB cases as an emergency to make sure that this 365-day maternal reduction be reality, not just to say in the air, but at CB Doma, our boots on ground and our hands on this to reduce maternal mortality.
First warehouse, we get 2 warehouses here. Here is one this way. Kind of this other warehouse.
Where we store most of our medications, because as you know, medication is supposed to be on a rarefied temperature so that you really get rarefied therapeutic effect. So basically we run the CRDF here so that medications can be scarce from the facility. Okay. So we use this place to run the CRDF, make sure that medicine are always in the hospital. So we get our product from the vendor or we get it from the government. We ought to receive it and then we store it in here. And we have a complete chain of command, which is the supply chain system. Store the medications here, and medicine leave from here, go to the dispensary. From the dispensary, then go to the end user, which is the patient.
CMO. Alright. He the hair, all the doctors and PAs in the hospital. Wow. So you tell you more about the procedures, what you got procedures in the hospital there. And now talking about this is Dr. Sarah. Is one of the major resources in this country.
in this region. Sibiloma is not just a problem with people. It is very important in this entire region because in my time here, in my experience, I've treated patients. We get patients from we get patients from Grand Bassa, might be here as far as Monrovia. So it is, like I said, it's not just important to work into.
Okay.
It is almost, in my opinion, a major referral center. So working here is it's kind of tough because the patient load is a lot, and then we do not have enough medical, personnel to cater to. So it's kind of hard. But again, we do our best to overcome the challenges that we face when it comes to medical aspect. You see that this place was originally a maternity center. So we have a lot of maternity cases, meaning cesarean section. OB cases come up. Sometimes we have, ectopic, ultra-ectopic. That's one of the main cases we have.
Our lab and how strong is our lab regionally in Liberia?
Okay, so my name is Emmanuel Gray. I'm the laboratory supervisor of Sibidoma Lab, and I've been in the field for almost 14 years now. And since we've been here, we've been working very hard. This is my first assigned area as a government employee. So since 2016, I took over the mantle of authority as supervisor for this laboratory. And right now, Sibidoma Lab is doing well when it comes to materials, when it comes to supply of lab testing material, daily testing materials, and the equipment. Now the lab is divided into segments, and here what we just entered, this is the first segment of our lab, and this place is called the phlebotomy site. Phlebotomy, for all the medical laboratory people will say phlebotomy, they all have to do blood drawing or collecting blood from patients. So this place is where we use as a site of sample collection from our patients. So when we say talk about sample, we talk about blood, we talk about urine, we talk about stool. We will not do stool collection anyway, but we instruct our patients here and they go and bring the stool. But primarily, we use this place basically to collect blood sample from our patient. I will call this place the phlebotomy site. Okay, so and then here from this session, we will enter the big lab. This is what we call the main lab. And in this main lab, we also have sessions in the main lab. This place is where we do our recording of our data. This is our data recording session. And seated there is our receptionist, Ms. Peter Duro. Peter Duro is the one who is responsible to record all of our test results. So when you want your test result, he's there to give your test result to you. And this entire place is all about data. You see our ledgers, you see our computers. So this section is all about data. And this place, when you see our refrigerators here, this place we consider this segment here as our blood bank area. Blood bank is where we withdraw blood from qualified donors and we store blood that are being drawn from no qualified donors. Here, let's start here. This is the bear we use. We use this bear to collect blood from our donors. When the unit of blood is collected, then we come here. Maybe we come forward. We store our blood in here. We use this plate to store our blood. As you can see, our compartment, we have the O blood stored at the upper compartment. We have the O negative below. You got the A positive and the O negative and the A negative. Then below here, The last compartment is the B positive and B negative compartment. We store our blood here. Whenever we place the unit, we close it to avoid heat entering the blood bank. And here, this place, we use this place to strain our donor. This is our husband, it's not a donor right now. But we use this place to strain our donor. As you can see here, donor screening session. People who come to give blood, we screen them here. We ask them for their name, where they're coming from, and who they have come to give blood for. We put them on the scale, we use the scale to weigh them, and then we do all the necessary screening. Like we screen them for HIV, we screen them for malaria, we screen them for syphilis, we screen them for hepatitis B and C. When they are qualified with the level of hemoglobin they have, when they are qualified, considering a blood test, if it matches with the patient they are giving the blood for, then we do the collection here, as I said. After the collection, we place it in the blood bank. And this place, as you can see here, this is our urinalysis and paracytometry session. Here, urine are collected from patients. Patients will be given urine continuum. These are our continuum here, but we'll go on the other side. You see what we're talking about. Patients collect, they'll bring the urine, and then thereafter, they are brought here by the technician. The urine are being processed. The ones that we want, we place them in this tube. This is the urine test tube. We place them in the tube. So even if we have 100 of urine samples, we got tubes that can convert it all. One urine sample, one tube. One urine sample, one tube. That is, if a patient brings his or her urine, or maybe 2 or 3 patients brought urine, we will, for example, we take the urine, sitting here, we take each of these tubes, we label it based on the initial or the label that is on the urine continuum that was brought for analysis. Fine. And
so I want to ask, all of the machines, are they fully functional?
They are fully functional. Fully functional. Right now, we are not keeping anything that is not functional. It's almost like God forbid. We don't encourage that. So here, these are 2 machines we are using for our urinalysis. We use the 2 machines, one for spinning. As you can see, both of them are working very fine. These are called urine centrifuge. We use them to spin the urine, and the one that we want to do analysis, well, we'll take from there and do the analysis. This is our incubator. We use this to stain our malaria slab. Incubator is used for other reasons, but for now, for our limit, we are not running in the microbiology lab, so we are not using it in the microbiology lab. We are using it right now to just stain our malaria slabs. Okay. Let me just quickly give you 1 or 2 slabs carried. Okay, and you see this. This is what we're talking about here. When we process the slab, this is a malaria slab. Right? When we process the slab, that is when we collect the blood from the patient, we place it on the slab, process it well, we make a malaria smell, and then we place it in here. Very good. I got a few here, for example. Here are a few we just collected this morning. These are a few slabs we collected this morning. So we put them here and make them air dry. We don't heat them. We call the heat off and just allow the fan to blow the air towards these smells so that they can air dry. So it's not good to have them heat dry. If you have them heat dry, the smell will crack and you'll not be able to see the parasites clearly. So we carry on air dry. So right now, you see that they are being air dry. And when they are finished, this place is our staining session here. As you can see here, staining session. We use, these are the stain. We have malaria field stain A and malaria field stain B. These are the cups we use. You see the cup turn around at it because the stains are being filtered. Every morning we filter our stains before we start the normal work. So these stains have just been filtered and they are still running through. So after everything, the technician will come and place them back into their respective container for staining our malaria slabs.
Like you got a very functional and effective lab.
Oh yeah. We are trying our best through the help of the administration and the Republic of Liberia, the Ministry of Health. We are doing well, and making sure to provide the necessary services for our people.
Okay, so speed, there's
So I just want to, we'll come here, I just want to take you here, this place, this one is body area here. This lab caters to the entire hospital, including the OPD. So this place is the OPD session. We use this place to collect sample from our OPD patients. Unless that other area I told you, we use that other side, the other phlebotomy side to collect sample from our inpatient, people from the ER and people from the ward. But this place is catered to the OPD patients. And in here, this is our safety cabinet. We use this one to process TB samples and other samples in here. So we are running a TB GSP sample. So then in here, sorry, as you can see, this is our supply and analysis room. Here you see we got our supplies here, we got our test kits here, we have our urine container here, and here also we run tests here. This is our hematology analyzer. In this machine we have 2 of it. This is another hematology analyzer, and this one is being actively used because when we run this, after a few times we run this. Because we don't want to keep running one over and over before it develops problem. So currently we are using this. And this is another one here. This is the electrolyte analyzer. And these 2 machines, these 1, 2, 3 were donated by the JMB, the Joseph Yuma Burka Foundation. Along with this one that does more than 100 tests. Right? And this is our gene expert machine. We use this one to do our viral load analysis and our TB analysis on this one. And this one here, this is our chemistry analyzer, fully functional. We have 2 of them. But currently we are using this one. And after a while, we also use this one. But for this few time, we are using this one. And so here at our lab, here at our lab, we do chemistry, we do liver function tests, we do kidney function tests, we do cholesterol, we do lipid, and so on and so forth for the chemistry aspect. Then, as I said, we do TB tests using the gene aspect, and we do the viral load. People who are on the HIV treatment, we do the test to see how effective the treatment is. So we do it here. And here, as I said, in machine, we do our CBC, which is the complete blood count. Okay. We check your entire blood to know if there's any infection in the blood, to know how effective the system is. We use the CBC, which is the complete blood count, to run that test. All right, and we also do malaria smell. Then we do a malaria test, we do a HIV test, we do your hepatitis B, we do your hepatitis C, we do your syphilis test. We do your urinalysis, we do your stool analysis, we do your skin snap, we do so many tests. We are wishing to do more tests. We are wishing to do more tests, and we know very soon, like we want to start doing the thyroid stimulating hormones. We want to start doing that test. We want to start doing progesterone tests. All those different tests, we're going to start doing them very soon. But for now, those are the few tests, a few labs we are running. And I'll just take you here. So if you check here, on our bulletin, these are the tests. These are the tests we are running here. And these are just some. You will have to update this.
So how many persons do you have working here?
So presently we have about 11 staff in the lab. We have about 3 technicians. We have 5 technicians, 1 technologist, we have an aide, we have 2 lab assistants, and then we have our receptionist who is responsible for documentation. And this lab runs 24 hours. We don't sleep. The only way the lab won't work except there's no current. But everything out here is based on electricity. All the equipment, as you can see, is based on electricity. So when there's no current, we're not working. We're always working. Current is always available. Though sometimes it may be on and off for a very short time, but we are on a 24-hour operation here.
Thank you so much.
So yeah, I want to say thank you ever so much for coming to visit us today. It's a pleasure, and let me extend deepest appreciation to our administration. They have helped us a lot. They are always there to help us. Currently, the lab holds a 2-star rating in the Republic of Liberia from a laboratory firm from South Africa. They came recently and they did an assessment in the entire country, assessing 4 different labs. And among the 4 labs, CB came out as one of the labs getting 2 stars. And we couldn't do it, we couldn't have done it just by ourselves. Or I couldn't have done it just by myself. So I want to extend things in appreciation to all of my staff. As you can see here, this is David Sewen, David Benda, Mr. Stanley Gigi, I have Patient Kule here, I have David Sewen, I have Emmanuel Dan, I have Musima Tule, I have Justina Wongen, I have Florence, and I want to say again, thank you ever so much. You are always welcome to visit us. Our place is open up to you. But after this recording, you have to sign a confidentiality form, because normally people will sign our form before you get any information from us here. So
the lab is up to date, second to none. Yeah, and I want to appreciate you so much for the work. Is there anything you'd like to say?
Thank you again once more. Like I told you, the lab is one of our strengths here in the hospital. Our lab is a regional lab. Like you heard you say, we're giving 2-star or recent by consultant from South Africa. So to get 2 stars as a lab in Liberia, you have everything to some extent in place. So in the region, we are a 2-star lab. Those who are working in lab know what it means to get 2 stars in Liberia. They will know more than you myself, because they know what they can pass to get 2 stars. So our lab is up to date. We are doing tests here. And like you see, the cost the money was launched on the board, like I said, we are doing more or less than what we have on the board, because our locality and our people here. For all hotels that is very calling the name, they are cheaper, very cheaper on the lower scale. Okay, because the policy is that we can go low, the cost that they put the board, we can go above the cost as it is. So our own cost is very low, so I put a full account to here and do that blood test and make sure that they are safe and know what happening about it. Thank you for all the time that you have here with us today. And it was good having you here to showcase more that we are doing here, be it good or bad. We thank you to you and your team for the work done for Liberia people and Africa as a whole, because we are Africa. But we want to be thankful to the Health Minister, our mother in health, Dr. Louise M. Poto, and our teams, the DMA, the controller, and all the teams at the Health Ministry, the DMP. They all are the reason why we are sitting here in the offices, because they are there guiding our step as we have to move along. And so we are working in each of the Poor County, Liberia in particular. So we are good here, some way somehow. But you know, in health, conditions always come, and you never finish your one for all. As we go along, we are trying our best to see how we can help the government Liberia through the agenda of the president agenda, to make sure that we play our part here in Bon County and other countries that come here for healthcare services. So we are thankful to the Liberian government for the allotment every year to the county authority, the county caucus headed by Prince Kemwe, and all our partners in health for the support towards my hospital.
Thank you so much for being part of this